I'm going to tell you David's story. David is a 50-year-old male. He's a salesman, and he's often on the road. One day, he has a road accident in the middle of the day on a country road. He crashes into a car that is coming in front of him. The result of the accident is one seriously injured person who was the driver in the other car, and himself, who had multiple fractures. Why did David have an accident? Was it a speed problem? No. David was driving below the speed limit. Was it an alcohol or drug problem? The two most common causes of fatal accidents? No. David doesn't drink nor takes drugs. David, in fact, fell asleep at the wheel. Drowsy driving is found in 23% of total accidents. The leading cause of drowsiness in car accidents is sleep debt, but David sleeps an average of 8 hours. Medical conditions involving drowsiness, such as sleep apnea, are frequently found. Having sleep apnea multiplies the probability of having a car accident by 2. It turns out that David does have sleep apnea, but at the time of the accident, he was apparently well treated by a CPAP machine. At this time of the story, I'm obliged to tell you how the care of patients treated with CPAP is going in France. In France, the treatment with CPAP is covered by the Social Security. The patient is first followed by a healthcare provider who gives the equipment and then changes it every 6 months for some components and every year for others. The patient is monitored annually by the doctor. The healthcare provider receives data from each of his patients on a daily basis. An alert system is supposed to be set up to report existing problems in terms of use or efficiency. With almost all healthcare providers, the only indicator that is looked at is the time of use. Why providers only have this index as a benchmark? Well, because the healthcare provider is paid according to the time of use of the machine. Medically speaking, time of use is partially relevant because it is true that the more the patient wears his machine, the better he is treated and protected from apneas. But this also implies that the treatment must be effective on apnea. There are at least 2 essential parameters in the machine report to monitor these 2 points. First is the residual apnea index, which is used to evaluate the effectiveness of treatment on apneas. And second is the level of leakage observed. Leaks can wake up the patient and make the patient drowsy. At this point, I'm going back to David and his story. So David had a machine. He was supposed to be supervised by the healthcare provider, but despite this treatment, David felt tired. He slept, but woke up tired. One of the service provider's technicians once told him, "David, you only put your machine on for 4 hours. You should put it on longer." So David has gone from 4 hours to 8 hours of use. Since David was still tired, he called his technician and asked if the apneas were corrected. The technician told him, "David, you had 50 apneas per hour before treatment, and now you only have 2 apneas per hour, so you're treated very well." As David continued to be tired, he consulted several doctors. He had many blood tests, but everything was normal. One doctor even thought David was depressed. David continued to drive even though he was tired until the day he had his car accident. Was he among the 10% of patients with apneas treated by a CPAP machine who remained tired? Well, no. It is a totally different story. David's machine report showed a usage of time and a residual apnea index within normal. But his level of leakage was 3 times the norm. Leaks can be present because the mask doesn't fit or because it's not properly secured. In David's case, there was a sound of leaks as soon as the air circulated it through the tube. There was a hole in the pipe. David fell asleep at the wheel, almost killed one person, was hospitalized for 2 months because of a hole in his tube. The technician had not been trained to look at anything other than the duration of use. This service provider did not change the equipment properly. In fact, the equipment had not been changed for more than 18 months. A couple of years ago, masks and tubes were changed every 6 months, then 12 months, then now 14 months in most cases. And in some cases, the patient has to call the provider to get the material changed. It feels like the market for sleep apnea and CPAP is getting out of hand. It results in patients who are not well cared for, and quality is no longer an important factor. On my level, I make sure that quality is present at all times for patients, doctors, and service providers. And I'm doing everything I can to deliver 2 messages. First message is don't look at the duration of use only, but also look at the residual apnea index and the leakage level. Second message is, did you change your equipment when you needed to? In addition, I gave the patient tools so that they can take in charge their own monitoring. But unfortunately, I don't think all this energy is paying off much. Eventually, I think I'll have to tell David's story more often. It will move more than 1,000 explanations to patient or 1,000 phone calls to the healthcare provider so that the quality is once for all at the center of the game.